Dr. Pekosz, I want to go back really to the core matter, which is social distancing. If we're wearing a mask, what's the appropriate distance?
Well, I think practically speaking, 6 feet appears to be a number that most people are quite familiar with. And I think all the data suggests that, if you maintain that along with a mask, you've got at least 2 things in place that will help prevent transmission. So I think that's the simplest thing to try to get across to people as an effective means of practicing this physical distancing between each other.
We're going into a colder season. The 90-degree temperatures in New York City are breaking, and things get a little chill. What is the chart of temperature and virus? Where's the break point on that in Fahrenheit, or if you insist, do it in Celsius for Francine?
Yeah, so, it differs for each virus. But it's been very clear that with SARS-CoV-2, the virus that causes COVID-19, we've had a lot of spread of that virus in the U.S. under conditions like you just described that are extremely hot and humid. With viruses such as influenza, we expect a seasonality of that, and there is data suggesting that cooler temperatures and lower humidity helps transmission. We think some of those things are also true for COVID-19, but the reality is so many of us are susceptible to infection that even under less than ideal transmission conditions, the virus sees enough susceptible people that it can maintain these transmission cycles, cause disease, and spread in the community.
Dr. Pekosz, how much do we know about long haulers, right? So there's a lot of apps. The media is getting, I guess, wiser in starting to look into this. I mean, once you've had COVID, is that it? Or are there a significant number of people that then have to live with legacy or repercussions, whatever you want to call them, for 3, 4, 5 months or even longer?
Absolutely. And this is, again, something that you only start to realize as you move into a pandemic. You see that many people are suffering 2 weeks, 4 weeks, even longer than that from effects of the virus infection. An important other aspect that's coming together is aspects of how the virus infection can affect your heart. And there's certainly now more and more evidence suggesting that there are long-term damage to other organs that may be a result of direct infection, but may also be simply a result of the immune response that this virus generates as it's working its way through your lung. So certainly we have to think about this disease as more than just a virus that can cause death in a certain percent of the population. It causes severe disease in relatively healthy people at a good percent, and it can cause these long-term effects in relatively healthy people. So we need a more holistic view of the true impact of this virus on health in general and on public health.
If we have a flu shot for all the other flus, why can't we have a flu shot for this terrible virus?
I think we're in the middle of trying to work out exactly what it takes to do that. There's been some fantastic work that's been done at very fast rates to try to generate vaccines, and we know that those vaccines can induce certain immune responses. Our big question, though, is, are those immune responses that the vaccine's inducing, are those enough to protect you from infection? And importantly, are they enough to protect you from infection in a way that's going to prevent you from even spreading the virus? Because it's possible that a vaccine could protect you from disease, but still allow you to spread the virus. So that's where the phase 3 trials that are undergoing now with vaccines are going to be very, very critical, because they're not just going to look at safety. They're not just going to look at, are you inducing antibodies to the vaccine? They're going to look at protection. Are people that get the vaccine less likely to get COVID-19 than a control group that has gotten a placebo? And that's something that we need to wait for those results to come through before we really invest in a widespread vaccination campaign, because we want to make sure that the vaccine is efficacious and not just able to induce some immune responses and providing an unclear amount of protection.
Andrew, what about, so there are these 8 reports about 5 different countries of people who had a second infection with COVID. Are they also able to pass it on to others? I mean, how much do we understand about that?
Yeah, so the last 2 weeks have been, we've seen a number of these reports, as you just mentioned, Francine, about people who have gotten a confirmed second infection. Now, this is different from people who are RNA positive for a long period of time after their first infection. These are people that appear to have cleared their infection and have evidence that they've gotten a second infection with a slightly different genetic strain of the virus. These are very rare to date. What those, though, give us is the opportunity to study people's immune responses. So we need to find those people, understand how they responded to their first infection and why that immune response left them vulnerable to this second infection. Again, I think this is going to be a rare occurrence so far, but those represent important cases that can be studied so we can learn even more about what it takes to generate a good immune response to the vaccine, and that'll help to the virus infection, which will help drive our work in the vaccine front.